What do you do if you think you may have the coronavirus, but there's no way that you can get yourself to a doctor for a test? Well, a company based in the Philippines has come out with an app that can help gauge that you may have the virus or maybe not. It's proving very popular in Africa. Now, thousands of Africans are using the app to test for COVID-19 symptoms from Ghana, South Africa, and Nigeria. Now, we go live to Manila, and Lars Jepperson, the CEO and co-founder of Tech One Global, who's come up with the idea. Now, I understand this business idea of this app, you actually fast-tracked it when the pandemic started breaking out. Just gives him an idea of how you did that.
Well, thank you, Chris. My daughter is a nurse. In fact, she is a COVID ICU nurse in Denmark. And over the past many years, while she was studying and while I've been seeing her on vacations, I've been thinking about how the next stage in medicine is going to be and how we are going to deal with the challenge of number of doctors and nurses available to the population, especially in emerging economies and countries. Across Africa, for example, the ratio is between 1 to 10,000 to 1 to 3,000 doctors per population, whereof in countries like Europe, in Germany, for example, it's 4 doctors per 1,000. So how can we deal with this situation? And we have been lingering with this thought for a long time, that how we can use technology to bridge the gap. And of course, day-to-day things came up and were pressing, and suddenly we are in this situation like yourself. I came back from a US business trip on the 9th of March, and within 1 week of returning back home, the country was in lockdown, and suddenly it became very relevant. So we put our energy together. We resourced all the information available on the net to bring together an application that you can actually use to do a early testing yourself. So it was more like moving from the fear factor of what are we doing in this situation to the how can we deal with this and how can we come up with solutions to deal with this problem. And I think we have come up with a good solution. It's a free app that anybody can use. You don't even have to download, and we have seen particularly well take up in Africa. So that's why we see that there's good hopes that this application can help the frontliners and help the population across Africa to deal with this issue, get some comfort that probably you're not sick. And if you are sick, then that's the only time that you need to seek medical assistance.
Just give us an idea of the uptake you're seeing in Africa. I mean, you mentioned 3 nations, particularly Nigeria, Ghana, and South Africa. You said there's tens of thousands of people using this. How are you going to try to spread it in these difficult times to get to more people in the continent?
Well, I hope this could be one of the ways that people would see this segment on this show and get some information. We are trying to connect with some Department of Health, Ministry of Health in different countries to try to get the app out there. Social media is one other thing. If people will spread the news, then more people can use it, more people can be saved, and more frontliners can be focused on people who are really sick. And I think that's the main concern right now. People who have a cough, people who have a slight fever, they think it's coronavirus. Let me go to the doctor and line up in doctors' places for many hours to get a test, if the test is available at all. And this fear that people have, this uncertainty, really is damaging to themselves, to the environment, to the economy, everywhere. So by creating this opportunity, hopefully people can use the app and then tell other friends and family that I use this app, and why don't you try to use it as well. So social media is a big factor here. In fact, we are about to start a major Facebook campaign on the continent for this app, so more people can use it. But I hope it will go viral as well. So we need the help of everybody to spread the good news. You can maybe even put the link here.
Just very lastly and very briefly, we're running out of time, unfortunately. What else you might be coming up with that can actually build on
this? Well, I think Yeah, so obviously testing for COVID is just one thing. I mean, don't forget that we have all kind of other things to deal with in our lives in terms of healthcare. So this is just a stepping stone for our organization, our company into healthcare, and we see this connected with a healthcare artificial intelligence bot that will be able to diagnose any disease, not only COVID but any other disease, by using a simple chatbot or text bot, SMS bot, to write back about the symptoms that you have, and eventually also give this to frontliners. Let's say a nurse, for example, who could take the blood samples, the vital signs, but not necessarily having a doctor in the front line to see every patient. But this telemedicine is becoming the digital transformation of healthcare. The new norm is you would probably be talking to an app before you talk to a doctor.
Thank you very much indeed. Live to us from the Philippines, that was Lars Jeppesen, the CEO and co-founder of Tech One Global.